Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks with Dr. Sanjay Kalra. आज के हमारे नॉन स्टॉप शो का 949वां 949th एपिसोड है. Let's talk about today's theme. Now, medicines are an integral part of life. We all have to use them for prevention as well as for treatment. The good thing is that our regulatory authorities and the pharmaceutical companies issue drug safety alerts, notifying healthcare professionals, members of the public, and patients about potential risks or safety concerns associated with specific medications. In November 23, for example, IPC issued a drug alert for cotrimoxazole, an antibiotic, indicating a potential association with FDE or fixed drug eruption. Fixed dose combination cough syrups containing chlorpheniramine and phenylephrine have also been under the scanner, and there are suggestions that there may be side effects with this. They especially highlighted that CDSCO has mandated clear labeling, advising against use of these FDC cough syrups in children below the age of 4 due to reactions like convulsions and rapid heart rate. With this background, with this theme, let's move on to our topic for today. Let's see what our topic is. Understanding drug safety alerts. So now this is important. If we know that we have to live with drugs, with medicines, whether for prevention or for cure, we need to know about drug safety as well. And how do we know about drug safety? If we understand what drug safety alerts are. So we need to know what drug safety alerts are and what they are not. For this, let's have an expert, someone who is well known across the country and someone who has contributed a lot to the development of Indian medicine. Warm welcome to Dr. Ketan Mehta.
Thank you.
Warm welcome, sir. Dr. Ketan Mehta is a renowned and experienced consulting physician and cardiopulmonologist and diabetologist in the city of Mumbai. An experience of nearly 3 decades. Now, that's a lot. Dr. Ketan, just on a lighter note, amongst the two of us, who would have more hair and who would have more experience?
So I think it will always remain a controversy and debate, and I think that we can go on and on. Thank you.
Later. And that's very important, actually, though it won't have a bearing on our topic for today. But certainly, we can debate, Dr. Ketan and I, who has more hair, who's. But Dr. Mehta has been associated with some of the best hospitals in Mumbai, such as Suchak Hospital in Malad East, Asian Heart Institute, Seven Hills Hospital, and Nanavati Hospital. He's an MD in medicine and is also a fellow of all the leading medical associations of the country. And he has contributed a lot to the growth of API, that's the Association of Physicians of India. Thank you, sir, for joining us. Sir, we'd like to know, and lots of people have joined in today. The question is, how did your interest come about in pharmacovigilance and drug safety?
Okay. Before that, I would say 2 points which I want you to rectify, because when you address me as Dr. Ketan, you are putting me automatically more senior, which I don't want to take. And secondly, when you say sir, you want to say that yes, you are more younger. Let's not put it. Let's not go into the controversy and debate. Okay. Thank you, Sanjay. So let's come to that. Now, very nice issue which you have raised about talking about pharmacovigilance and pharmacosafety. In fact, I have been representing Indian Medical Association. I was, in fact, a president of the IMA Mumbai West recently, and we had a couple of years back a conference which was held with various organizations, including OPPI, IMA, and where there was a talk on pharmacovigilance, and there was a panel discussion, in fact, and I was invited as one of the panelists, and that was the first time I started having interest on this, and I realized there are so many things. As a clinician, we start using drugs left, right, and center, but at the same time we need to see the other side of those medications. What are the rules, regulations, how does it can affect the clinicians when we prescribe it, and how it is also affecting the general population who is taking it, the our patients. And that from that day onwards I started realizing, yo, there is lot of points which need to be learned in that. And definitely I started realizing, and here I would give a definitely credit to this med talks. And of course my senior, one of the teacher I would say, or a mentor of all of us, late Dr. KK Agrawal, who has started this program. So I pay homage and tribute to sir on this occasion. Thank you.
Thank you so much. And lots of people logged in from India greeting you. Devjit Chaudhary Sahab, Pankaj Dubey ji, Rahul Nikam, Gaurav Mandava Gade, Rahul Kumeria, G. Sham Sundar, Gulam Hussain Khan Sahab, Prem Nagela, and Naveen Gupta ji, Sham Buketar, all greeting you. I never realized, Ketan, you are such a celebrity. So it's an honor for me also to be sharing the dice with you.
Or rather, I would say the other way also. When I'm sharing a platform with Sanjay, it is a proud moment, and then obviously the value increases. I think let's both of do together and take it further. Thank you.
There is this Haryanvi proverb as well. 1 plus 1 is equal to 11, not 2.
Yes, right.
Amit Sharma and Rinku Sharma, Abhijit Kumar also join Himanshu Sharma and Amit Tyagi in greeting you. And Mumin Zohib Saab also sends you a good evening. The
Good
question is
evening to everyone. Good evening.
a question from Pratibha Patil, Madam, and Narendra Sharma ji is what are drug safety alerts? So, could you break this down for us? Drug safety and alert.
Fantastic question. So, a drug is any compound which is used by modern medicine, which is been used for either to correct the underlying medical problem or to boost up the general condition. So, it is basically a pharmaceutical compound. When you say about the safety, now always remember the drug which or a compound which has a effect on any in the body system also going to have some ill effect also, which is always an integral part of the compound. It's like any coin has got two sides of it, so you can't have a single sided coin. So similarly I always tell, you can't have a single drug which is without any ill effect. So I would not put it side effect, it may be a ill effect. So when we come to safety, we mean that how does it is having effect on the all the bodily metabolisms and having issues, is it causing any harm to the body? So that is the safety part of it. And alert means obviously you are making the clinicians, that is the prescribers of this medicine, as well as the general population, aware about that so and so thing can happen, because everybody may not be aware about certain side effects. But when it comes as an alert, it becomes mandatory as a clinician for us, and as a patient whoever is going to take should be aware about it, and that is the alert. So that is how it comes as a drug safety alert. Thank you.
So that's a drug safety alert. Thanks for making us aware. Good evening to you from Shatrughan Koliji, Sheikh Rahman Sahab, Rajesh Kadav, and Saroj Kumar Patnaik as well. Muhammad Motashim asks us, along with Jay Kanojia, who issues drug safety alerts? Can anybody do it? Can you and I do it? Or are there regulatory authorities, government authorities which issue official alerts?
Again, a very pertinent questions. So this drug safety alert comes out every month from IPC, that is Indian Pharmacopoeia Commission, which is under the jurisdiction of Ministry of Health and Family Welfare. So they collect the data, they get all the intimations, and they come out every month with this drug safety alert. The head office of IPC is very close to you. It is in Ghaziabad. So that is where their head office is. And the by all means they come out on the last day of the month, that is by standard norms. Like if I recollect, the last drug safety alert was released on 30th of November. I did not see any drug safety alert coming for the month of December yet. All you know, they may come out on 31st. I am surprised how the government sector is still working on the last day of the year, which will be on Sunday, but still, that has not yet come. So it is not you, me, or any XYZ can release this drug safety alert. It has to come. This is the only authorized body who comes with this drug safety alert. Thank you.
Banu, Prashant, and Mohit greet you, and so do Ganesh and Samira. And they ask, Sir, who is this alert meant for? Is it meant for medical practitioners or for members of the public?
Again, it is meant for everybody to begin with. Where does the drug is going to be prescribed? So obviously it is at the clinicians or the doctors level. And who is going to be the consumer? It is the patients or the public who is going to be the consuming those medicines. So it is pertinent and important for both of them. I would always put it, doctors obviously doesn't mean that they know A to Z about it. There may be some rare points which they might have read earlier during their study days or anything, and which are rare to be seen, and they may not recollect or recapitulate, but this is the way by which it makes them aware. So it is important from both the sides of the people, one who is going to be prescribed and one is going to consume. Thanks.
What you are saying reminds me of what our teachers used to teach us. Long ago, maybe 30, 40, 50 years ago, it was said that that person is the best doctor who knows everything about medicine. But now nobody can know everything about medicine or any other field of science. So now it is said that person is a good doctor who is humble enough to admit that he or she does not know anything about everything about medicine, but who is also intelligent enough to know where to get the information from.
Exactly, exactly. And here it reminds me a beautiful quote from Sir Isaac Newton, who states that what we know is a drop, what we don't know is an ocean. And I think it is true at any level, be it pertinent to our medical field. Also, I'm sure. I mean, you being an endocrinologist, but I know the way you know it because you still need to keep yourself updated. Because every week, if you don't read it, there are so many new things come, and that is so much true in any field of medicine. Yeah.
Though Dads and Shailesh and Sitaram join me in saying that when you think of Isaac Newton, you think of quotes. And if I were to think of Newton, the closest I would reach would be this wonderful Hindi movie where the song is Newton ek din save girega. So that's a Hindi song from a Bollywood movie, Newton ek din save girega. So the quiz question for everyone is, which movie is this and who's the hero? Who sings Newton ek din save girega? Very optimistic song. Newton, someday this apple will fall and someday we'll become intelligent. So while Sita and Seali and Nilesh, as well as bold gamers, work with their friends to find out the answer to that quiz question, uh, one question for Dr. Ketan is, now a safety alert has come, a drug safety alert. Does that tell us that the drug is banned, that the drug should never be used? Or does it tell us to be vigilant? What does the drug safety alert tell us? Does it make us more confident or
Okay.
less confident?
Okay. So again, it's a very tricky question, and I would give you definitely a tricky answer to it. Now, drug safety alert is absolutely altogether different from banning the drug. Means this is the authority which is just making the clinicians and the general public aware that so and so thing is possible with this particular compound. It does not mean at all that this drug is unsafe or this drug cannot be used forever. Otherwise, again a separate approval and disapproval or disqualification of particular compound which will come, and that is also by the government only. It comes, so there are authorities for it. And like, for example, any new drug approval comes from the approval from DCGI, Drug Control General of India. And similarly, the banning of drug, that this henceforth this drug cannot be used. If you remember years back, there was a very nice compound rosiglitazone which were used for diabetes. And I remember you had taken a beautiful talk on that. But because of the certain issues, now that drug had to be banned. So that was got over here. But that was not equivalent to drug safety alert. Now in drug safety alert, it is only notification of that so and so side effect or ill effect can happen, but you can continue to use this drug without any issues. All you know, that side effect prevalence would be very very minuscule also. So sometimes it is 1 in 1 lakh. But only point is government is making us aware that such things can happen with this particular compound. So this general public should take into consideration and not to get little more confused about it. Rather they should feel, I would now in your words, they should feel little more confident. Oh, okay, this has come, so that means government is not banning this compound, so it allows its usage in the society, in the public. Thanks.
Yeah, I would agree with Dr. Ketan that these drug safety alerts actually make us more confident
Yeah.
because now we know what to look out for. Kaushalinder, Faisal, and Pankaj Dubey are with us, and so are Ravi Kiran, Sumanta, and Noor Muhammad Saab. Bajrang Sharma and Sudarshan Saab Kota add a very philosophical angle to this discussion. They say that even in the Bhagavad Gita, it is written that wherever there is fire, there will be smoke. And you should, the message of that classic is that you should keep on doing your work as long as you know it is the right work to be done. So, as long as you are helping patients, helping the public, relieving pain, you should keep on doing the work. If you get some pushback, maybe in the form of an adverse drug reaction, it is not that you stop doing the work, it is that you should be aware of what is possible and you take the right steps to minimize those adverse effects. So, thank you, Sudarshan, and also Hari Vemula and Yuvan Sharma and Sarvesh Tiwari for adding to this philosophical discussion. Sir, there is another question for you. This comes from Himanshu, Vanilla, and Sudipta Pradhan. Sudhir Singh and Sadan Singh also have the same questions in their mind. This is that recently there was a lot of issue in the media about mefenamic acid, specifically Meftal. So, what were these issues, and can you put them in perspective for us?
Okay. Now, as you said, Meftal is one of the brand for the generic compound, what we call mefenamic acid. Mefenamic acid is the compound which is used for the treatment of arthritis, be it rheumatoid arthritis, osteoarthritis, even female uses during the menses for to relieve dysmenorrhea. It is overall used for mild to moderate pain reduction, reduction of inflammation, for fever which is not responding with standard paracetamol, even for a good for a dental pain. Now, this drug has been used for years together, which is, and one of the commonest brand is the Mefta. Now, recently, again, as I said, in the last month, 30th November 2023, the drug safety alert came from this molecule, especially for this molecule, that it has a serious effect, or rather side effect, which is something called as stress syndrome, and which by which it can lead to various manifestation in terms of skin rash, in terms of fever, body ache, myalgia, fatigue, weakness. There is a blood hematological abnormalities, that is on blood, CBC, and there are various other internal organ involvement, and this made big hue and cry. Unfortunately, I would put it, in our society, when something comes up like this, the social media, the one who are bloggers, everybody comes out. I don't know for what reason, whether to draw attention or whether to seek attention. They will come out with their ideas, views, and everything. Now, I fail to understand. This is just a drug safety alert coming from the government, agreed from released by IPC. But what is new in that? This is not something new. This is exactly like old wine in new bottle. The side effect is rare, but it was a known side effect. It is not that you have reported this for the very first time. The only thing is it blew up to such a large level, as if now if somebody writes or prescribes meftal or mefenamic acid, it has become a big, nonsense by the particular doctor, and then people cannot take it. I mean, this literally misguides the people. So I would say this was very wrongly put. I don't know how we can even convey to it that, the from the Ministry of Health and Family Welfare, when they come out with it, every time probably they should come out that what is the prevalence of this side effect. In fact, let me tell you, I was just going through the literature. I have not come across any literature from India where this side effect has been reported. So why so much hue and cry? It is like somebody tells me, don't cross the road because there is a chance of you meeting with an accident. What will happen? I will be stagnant at that position only. The only thing is, I need to be careful that I cross at zebra crossing. I cross it when the lights, green lights for the pedestrians are on, and that is how I can go to the other side of the road. If I cross it somewhere in between on an expressway, I know I am keeping my life at this thing. So same thing exactly what had happened with mefenamic acid.
Thank you for putting this into context for us. And even I feel like you said dress syndrome, there is another syndrome known as ASS, which is attention seeking syndrome, which I think many people on social media suffer from. And then you know what they are. It's even donkeys would get upset. Even they don't seek so much attention. But
Right, right.
adding to that philosophical discussion, Muhammad Irfan Sayyid Sahab, as well as Muhammad Jahangir and Hussein Waniawala, they mention that in the hadiths are sayings of the Prophet, peace be upon him, and he has very clearly mentioned that God has created a cure for every disease except old age. So,
Correct.
pain, menstrual pain, menorrhagia, these certainly do not qualify as old age. Certainly, they don't. So, if there is pain, then God has created painkillers. So, it becomes a religious duty also to maintain your body, because if you do not maintain your body, you will not be able to maintain the heart or the brain within it. This teaching comes from Buddhism as well, and Sahil Batra and Sanjeev Kumarji point this out very rightfully so. So,
Right.
when you look at philosophy, also, whatever religion you believe in, whatever philosophy you follow, you will find, like Uday and Vishal and Himanshu tell us, that we are encouraged to be more proactive, not to just sit back and do nothing at all.
Right.
You
Agree.
mentioned, Dr. Chetan, that acid has been there for a long time, and actually, this is the diamond jubilee of mefenamic acid, the year 2023. It was discovered in the year 1961. The first approval came in the United Kingdom in 1963. So exactly 60 years.
Right.
And that's the diamond jubilee that this drug is celebrating this year. So it's 60 years of service to mankind. That's
So,
what it is. Yeah,
yeah. So
carry on.
here I would
Carry
I would definitely add. So mefenamic acid is definitely senior than both of us.
on. Both of us. And Yovan Sharma is with us. He has such a youthful name. So Yovan Sharma says, "Sir, it is senior to me as well." And then Rahul Gulati, Sairam, and Praveen joining in saying, "Sir, mefenamic acid is senior to the age of all of us put together."
Okay. Hmm.
60 years is a long time in the service of mankind. A single drug going strong. Shrijit, Prashant, and Mahesh Rava say, "Sir, how many other drugs do you know? Can you count on your fingertips? Drugs that have been serving mankind for more than 60 years without any change." Because mostly what we see is drugs come and then drugs go. So, how many drugs can you count offhand which have been there for 60 years and they have not moved since then?
Yeah, so I'm sure that will be a very, very small numbers which we see. If we talk about the aspirin, if we know about insulin, if we talk about the sort of painkillers like a paracetamol, so these are the few drugs which you there. I'm sure it sulfa group of drugs which has been there for there. So it would be a definitely a very small numbers if we really think of it, because all the newer modern medicine drugs, if we really see, are come up in last 4 to 5 decades only. So there of course we must rather should salute the drugs which has been standing a definitely war of time for such a long period. I really appreciate that.
And it's actually very few. We can work hard. Sandeep, Sumanta, Parveen, Rakesh Baveja, and Shivkumar Rao, Ajay Pandey, and Yamini Sajid. We can work together. I doubt if we would be able to cross 10 drugs. Even when you say insulin, the preparations have changed, the purity has changed. It would be very few drugs like digoxin, aspirin, mefenamic acid, which still continue. And for most of them, the indications have shrunk actually for aspirin and for uh, digoxin. The indications have reduced in number. For
Right.
mefenamic acid, they remain the same.
Correct. I fully agree.
Uh, Rajesh Bhargav and Vinod Manchanda ask you, sir, along with Jay Kanodia, you mentioned dress syndrome, DRESS. So is it beautiful dress? Is it pink color? Is it green color? What does dress mean, sir?
Okay, now dear friends, now this stress syndrome, it's an acronym. When we say DR, it is the drug reaction or drug rash. With E stands for eosinophilia, and SS is systemic symptoms. That is, this stress syndrome, it is a conglomeration of various features where somebody develops a cutaneous reactions, that is in the form of skin lesions, which can be a minor macular rash to extensive exfoliative dermatitis type reactions. Plus, they have a eosinophilia. That means if you do a CBC complete blood count, there will be an increase in eosinophil counts. And systemic symptoms, by which they means they will have fatigue, malaise, body ache, feverish feeling, along with systemic organ involvement. So all the itis, so they can develop hepatitis, they can develop pericarditis, they can develop nephritis. So all this itis, so all this put together, it is comes as a syndromic name, and that is the dress syndrome. That is how it has been labeled. It is basically nothing but a hypersensitive reaction. It is basically a delayed type 4b hypersensitivity reaction. And maybe because there are few medical people who have joined over here, I would just for their knowledge, it is mediated by T cells, and still the exact mechanism is not been identified. So it is just a conglomeration of this. And again, this dress syndrome is nothing new, which has the coin. This name has been coined almost more than 2.5 decades back. Thanks.
Like Dr. Ketan said, the exact mechanism we still do not know. And there are many ifs and buts regarding this. For example, ethnicity. We'll talk later about which other drugs cause stress syndrome. But for most of those drugs, you find that the maximum reports come from China and from Korea. So it is people of the East Asian ancestry or East Asian ethnicity who are more prone to stress syndrome. From India, we have very few reports actually for any drug. So it would be something to do with the genetic makeup of the individual.
In fact, just to add, with your permission, it is even it has been known that there is a very high genetic preponderance. So somebody who has in the family developed this, there is the first degree relatives are at a high propensity to develop this dress syndrome. So that is one thing, yes, which should be the clinician should be more aware about it, taking the history, especially for prescribing the drugs with having a propensity for this. So as you rightly said, genetic factors very plays a very major role in such type of reaction. Thanks.
Rahul, Praful, and Junaid Khan, thank you for that very simple explanation. They say now they've understood the issue. And Praveen and Iftekhar Alam and Mansoori Faisal say thank you because they're very relieved. Now they can wear their best dress and go out to celebrate New Year tomorrow, New Year's Eve tomorrow. Otherwise, Ravi Kiran and Arohi and Yamni Sajid were afraid that if they wear a particular dress, that might predispose them to side effect of a drug.
Dress syndrome.
Yeah. Uh, Bidas Maurya and Mahir Mansoori, along with Harpreet Dhiman. They ask us, they have this very important question. Sir, all this hue and cry, why did it come about? What are the specific safety concerns that we should actually be worried about with the mefenamic acid or meftal?
Okay. So basically, it is, there was some report which has gone to the ministry, and on which they started evaluating. And yes, they found that there was a literature mentioning about this drug. Now, this is not something new which has come into the limelight, which was already pre existing. The only because there was a little hue and cry which was made about it, this was blown out of proportion. And it, when it came out, as I told you earlier, the social media, the bloggers, and they took it to a different height altogether, making it absolutely out of proportion, or totally disproportionate to what the issue is, and creating a more of a ruckus of this lovely molecule, I would put it. It is anything what you handle it, you need to handle it in a tactful way. See, we as a clinicians, when we prescribe medicines, it in fact we are well aware about its side effect. In fact, it reminds me a quote from Sir William Osler. He is the father of, considered as the father of modern medicine, and he had put it very beautifully that it is the first duties of the clinician is to educate the masses not to take medicine. And then you start wondering, he being the father of modern medicine, and he is discouraging. Why? So in his second statement, he clarifies it, that the person who takes medicine has to recover twice, once from the disease and once from the medicine. So I would say that is so much true, be it any medicine. Today, somebody takes, somebody, because I remember in practice, asked me, is there any side effect of this drug, that drug? Now let's come to, somebody asked, is there any side effect of multivitamin B complex? I said, yes, it causes yellowish discoloration of the urine, which is a variation from your normal effect. So you can call it a side effect, but does it really matter? But point is that even your multivitamin B complex can cause the ill effect. That means you must remember there is not a single compound which is without a side effect. Only thing is at what percentage it causes. I would say that in 100% of patients, multivitamin B complex will cause yellowish discoloration. But does mefenamic acid causes in each and every individual this DRESS syndrome? No. So that is what the whole issue is. People should be aware about it. Thank you.
Uh, and lots of comments and actually appreciation coming your way, Dr. Ketan, from so many people saying that you're explaining things in very simple language. So thank you for that. Even water can cause side effect. There's something known as water intoxication. If you drink too much water, and if somebody forces you to drink water, maybe you're in hostel or someplace, the least you will get is a tummy ache. And supposing somebody has heart failure or kidney disease or liver disease, that person might land up in the hospital just because of having drunk too much water. So there is nothing that cannot cause a side effect. That's one
Right.
thing. Things that we would like to take in the kitchen, maybe spices, salt, pepper. These are good for health. They increase the taste of our food. But if you take too much of maybe pepper, you might again get a stomach ache, and then you would need to take more medicines for that. If you take too much of salt, you can get accelerated hypertension or high BP, especially in North India in winter. So everything should be taken in moderation. And this brings us to a question which has come from many people, and the question is related to what is the difference between ADR, adverse drug reaction, and drug safety alert. This question comes from Muhammad Jahangir and also from uh, Satish Mehta uh, Abhishek Kumar, Sachin Purvendu, and Rimal Yadav. So, what's the difference between ADR and uh, DSA, Drug Safety Alert?
Okay. So adverse drug reactions enlist the entire side effects which is pertinent to the molecule. For example, uh, let's take it a plain simple drug like paracetamol, which everybody must be using it. So it can cause as simple as mild gastritis. So that is a GI upset or pain in the upper abdomen, nauseating feeling, vomiting. So that would come as an adverse drug effect, adverse drug reaction, but it is not a drug safety alert. It is not causing any life threatening issue as a mild gastritis. So the complete listing of all the possible side effects, for example, as I said, what multivitamin B complex, you can yellowish discoloration of urine can be considered as an adverse drug reaction, but it is not comes under the safety alert because it is not going to cause any harm to the body or the life threatening risk to the body. So there is altogether, so the whatever comes under drug safety alert would be a part of adverse drug reaction, but all the listed under the adverse drug reaction does not come in drug safety alert.
Right. Yes. And I'll take this comment by Mohit Arora. Very handsome DP, Mohit. So look good. So Mohit points out that the regulatory authorities got to know about DRESS syndrome after 40 years. The reason is that ADR, adverse drug reaction reporting, has become more and more common in India now, and that is a very welcome, very very welcome development. So there is this automated system where any member of the public, a doctor or anyone in the public, can go and report an adverse drug reaction. So, depending upon the report, the regulatory authorities assess it, they look for causality, and then they decide whether a DSA should be raised or not, a drug safety alert should be raised or not. The thing is that actually it is so rare with mefenamic acid that it never occurred in the past 60 years, or very rarely it would have occurred, and that's why it's come to notice now. And on the other hand, there are many other drugs, including paracetamol, which can cause DRESS syndrome. So, questions are from many people in the audience, including Vinayak and Praveen, Krishna, Wasim Sayyed, Satish Mehta, and Amit Singh. This question is, sir, what are the other drugs, the other classes of drugs which can cause DRESS syndrome?
Okay. Now, this is a very, very important question over here since we are discussing the relationship with the DRESS syndrome and the mefenamic acid. So, let me tell to our audience that this DRESS syndrome, which is has come as a safety alert, which is not just with mefenamic acid, it is basically is known with entire group of what we called as non-steroidal anti-inflammatory drugs, the all the common painkillers which people are using in their day-to-day usage, whether be it ibuprofen, be it diclofenac, be it acyclofenac, even the aspirin, which were earlier people were using it as a painkiller, and of course, as Sanjay has already mentioned about paracetamol. So all these class of drugs, I mean, they are have a potential to cause the DRESS syndrome. So that is one. Besides that, there are certain drugs, the drugs which are used for epilepsy, anticonvulsant, what we called. Then the drugs which are used for infections, antibiotics, in which there is a class beta-lactam antibiotics which are known. Then there is a vancomycin, sulfa group of drugs which are known to cause this. Then there is a drug which is used for gout, what we call as allopurinol, which is also known to cause. Then there was a cardiac drug, captopril, which has a potential. And of course, now for HIV, what we use antiretroviral drugs, which are also known to cause. So if you see, there is a whole big list of agents or drugs which causes this, but I am surprised why this came only tagged with mefenamic acid, because it's a clear cut mentions it is attached to NSAIDs, non-steroidal anti-inflammatory, in that category. And as I mentioned it, the prevalence, which is so rare, why it has come up suddenly, which is obviously we really have to stretch on it and make the things clear on it. So you must be aware that these are a number of drugs which can cause this stress syndrome.
Thank you, sir. We have a very interesting comment from Shrikant Firke, who points out that Meftal is as senior or as young. It is 60 years young. And another person, a very important person in Indian pharmaceutical, who is 60 years young, is Shri N.H. Israni, who is the founder and managing director of Blue Cross. So thanks, Shrikantji, for pointing that out.
Okay.
Blue Cross itself, in fact, is more than 40 years old now. So, our question is, uh, what would you call an association or an organization or a person who is aged between 40 and 49? And let's give you two hints. So, let's see if we get the question answered right in the audience box. Uh, Blue Cross was launched in 1980, so that makes it 43 years old now, 43 years young now. So is it a quadragenarian organization or is it a quinquagenarian organization? That's the question. Quadragenarian or quinquagenarian? That's the question. Gaurav Gulati ji points out that KK Agarwal sir, who was the founder of KK MedTalks, he used to specifically advise Meftal during COVID times because it would help in bringing down both fever and pain. And that's right. Mohammed Jahangir, thanks you for answering the question about adverse drug reactions so well. And Rajkumar Nandaji, Narendra Sharma, Jagdish Mali Patil, and Prakash Pujari, they ask about what should be the way forward. Uh, so much of hue and cry about virtually nothing. They made a mountain out of a molehill. So two questions, sir. One for you, one for the audience. The question for the audience is, in your local language, whether it is Marathi or Bengali or Tamil, what is the proverb or what is the metaphor for a mountain out of a molehill? How do you say that in your language? And the question, Dr. Ketan, for you, the difficult question is, how do we move forward as a medical profession? How do we move forward in making people understand the value of drug safety alerts without going overboard in their response? How do we get a very pathway and a very balanced response to drug safety alerts?
So, you want me to answer first, or you want the general public to answer from your
I
first
will get
question?
you to answer, and then because there's a lag period, in 30 seconds or so, the answers will begin coming.
Okay, so the best way I would say is to reach to the large number of people is through the Med Talks hosted by Dr. Sanjay Kalra, where we can give the right information to our general public and the audience who are listening to that. That's one. Secondly, it becomes very imperative the duty of the physicians or a practitioners to give the right information, because whenever they are prescribing Meftal or mefenamic acid for that matter, they should be telling them that don't get worried about whatever you and Christ. This has been the drug which has been time tested, which has been used in the past. Only thing, it has to be taken under medical supervision. That is the one thing. There should not be people taking it for months and years together and then landing up with the problem and unnecessarily giving bad name to the molecule per se when they know. So that is one thing which has happened. And here, it reminds me exact corollary to a compound which you and me were facing while prescribing in diabetes, named pioglitazone. There was a big hue and cry where both of us have witnessed when it has come in between. It came under the scanner, then it was banned for some time, then the ban was revoked, and afterwards there were so many patients. Whenever I had continued writing after that, but there were questions coming to it, and I used to make it a point, I am writing this medicine because it is indicated for you, because these are the benefits, these are the advantages which you have, and look, this has not been banned. The side effect which has been noted is one out of XXXXX, whatever we are telling it. So it becomes very important, the duty of the prescribing consultant or a family physicians to create the awareness about the misnomers which the lay public has got. See, we don't blame lay public because they would go by today. Social media has become such a strong, powerful media. So we have to break that. This is for you. The social media is for general public, but for you, this is beneficial, and there you need to go. So that is how I would definitely suggest that the role of a family physician or a consultant who is prescribing and writing this molecule is very, very important.
So the message we are getting is that first of all, we should empower the physician, the medical care provider of India with the appropriate knowledge. And once that is done, then it is the physician's responsibility to empower the patient or members of the public with a very balanced opinion about what is going on. That yes, this is what is being said generally, but you are an individual, you are specific, and this is what is required for you. You can use many examples. One example might be, someone may prefer hot water, another would prefer lukewarm, and yet another would prefer ice cold water. The same person, let's say it's me today, right now it's winter, so I would want a glass of hot milk, but 3 months later I would want ice cold milk. So you have to prescribe the drug based upon the suitability for that particular person at that particular time. Keeping this in mind, sir, one of our superstar attendees, his name is Sunil Jaiswal, and he's from Jogeshwari. So Sunil Jaiswal greets you and asks, sir, JN.1 virus, what is this, sir? And this has also been highlighted. Uh, what should we do in Mumbai and across the rest of the country to prevent ourselves from getting JN1 virus?
Okay, so obviously again this is how the social media creates so much hue and cry about viruses which has come up now. Again, I would tell that today the large number of audience who have joined also, today we have a more number of cases of influenza than anything else also in the, which is prevalent. People just forget it because, oh, finally it's a common flu. But something which comes then suddenly comes up, 11 cases of J.1 virus which has been reported, and it gets flare because of the media which is taken. So basically what I would say, you need to do a universal standard precautions today. When it is, of course, the cases are on the rise, the precaution which you should be easy is avoid crowded place. If you need to use it, you can wear the mask, that is the simplest thing. And the hygienic standard protocols which you were following, and when the lockdown and pandemics were there, just a simple hand hygiene or the cuffing etiquettes and all this simple thing which will be helpful not only to you as an individual but to the society at large. So that would be a thing, rather than getting panic about all this, because there will be, now we are in such an era, you will see every few months some other nomenclature virus which will come up. How are you going to take care? Just taking care of basic simple principles, rather than getting worried about or getting afraid about how do we go about it and tackle the issue.
Thank you so much. And in the Bhagavad Gita also, they describe three types of reactions. These are nouns, Rajas, Tamas, and Sattva, and the adjectives are Rajasic, Tamasic, and Sattvic. Now, your response to any kind of stimulus should ideally be Sattvic, which is balanced. It should be a Sattvic response. That means you are in balance, you are in equipoise. However, the Gita also reminds us that in spite of having given this advice, you will still be confronted with non sattvic behaviors, non sattvic stimuli from the environment. Sometimes, if you go overboard, that's fine. You accept whatever happened with sattvikta. So, let us say we went overboard for whatever thing. Maybe, like Jitendra Tiwari ji tells us that milk has got proteins which can cause adverse reactions. That's true. There's lactose intolerance. Gluten is there in wheat flour and barley flour that can cause adverse reactions in some people. So these things are there, but we should try to approach them also with satvikta, with balance. That's what Dr. Ketan is telling us. Thanks, Jitendra, for pointing this out. Yeah, and Dr. Siddharth Dhanger, who is a very upcoming diabetologist from Mathura in Uttar Pradesh, has joined us. Dr. Siddharth is an expert at using local language, local dialects to explain to people how to keep things in balance. So, one way that Dr. Siddharth uses is that there are side effects in everything, even in crossing the road, like Dr. Ketan told us. That doesn't mean we will not cross the road. We will be active, but we will be vigilant also. while being active. Riaz Sheikh thanks you for the multivitamin example because that is something that is useful. Rahul Nikam says that now actually the NSAIDs have got effects like uh, maybe gastritis with prolonged use. Maybe you can't use them with aspirin in people with severe heart failure, not with stable heart failure, Rahul, but with severe heart failure. The severe heart failure person will usually be hospitalized or will be taking treatment from a cardiologist. Uh, People speak about renal complications as well. So the question from Rahul is, how do we approach this in a balanced manner, and how do we tell our patients and their doctors also about when they can take mefenamic acid, when they cannot take?
Okay. So again, a very good question. So here the point is, whoever has got a issue about renal, or what we called as CKD, or chronic kidney disease, or renal insufficiency. So no NSAIDs are recommended during that time. So because they have a propensity to worsening of the kidney function, and the clearance of the drug gets delayed, and then you are more prone to side effect of the drugs. So there is clear cut no once you have a what we call in layman's term kidney failure. Kidney failure could be early also, it can be a long standing stable kidney failure also, to be avoided. Now for otherwise healthy individual, whenever you are taking, it should be taken for a shorter duration, which is absolutely safe, provided the person is well hydrated. That's very important point, the hydration. Because what happens whenever these drugs are taken, their oral intake has gone down. Say for example, somebody who has a fever, body ache, their overall intake has gone down, hydration status has been poor, they take repeated like painkillers or like mefenamic acid, and then they have a propensity to develop suddenly their creatinine, which is a marker of kidney function, which worsens, and then they will attribute to mefenamic acid. I said, why attribute to a particular, or for that matter any other drug? It is because you were underhydrated, you did not maintain your hydration, you took the medicine, and it has caused the problem. So with in a normal person for a shorter duration of time with a good hydration, absolutely no issues when you're going to take this. But for a renal failure patients, of course it's a big no for entire, and this applies to all NSAIDs, that is non-steroidal anti-inflammatory drugs.
So, two very important points. It is not just about mefenamic acid, it is about all the NSAIDs, which would include diclofenac, ibuprofen. Avoid them in people with severe kidney disease, severe heart disease, severe liver disease. But otherwise, if your patient is stable and his liver function, kidney function, heart function is normal or stable, then the drugs are safe to use. We should also remember that mefenamic acid is very rarely going to be used, like twice a day for 6 years on end. It's not going to be used like that. It's going to be used for a short period of time. So the risk of side effects is lesser. The risk of side effects is much more with some of the blood pressure lowering drugs and some of the anti-diabetic drugs which are used for years and decades on end. Sir, while you were answering the question, Panchanan Rotre and Satish Mehta rightly answered quadragenarian. That is the youth, not the age. That is the youth of Blue Cross. It's between 40 and 49. And Panchanan Rotre asks another question, a follow-up question. Sir, what advice would you give the media of the country? How should they report on health-related issues?
Again, so rather than coming out with their own views or suggestions, they should always consult a medical specialist and take the right perspective out of it. Because today, for example, if I have to comment about some engineering issues and I come and speak, though I have a power to speak for, my people are going to respect me, but that would not be right. So similarly, they should take help of the right medical team, whoever they have an access to, and come out with the right information. Their job is to create the right awareness which can help the general population about the situation, rather than creating a havoc or panic or a misinformation or wrongly blown up situation. So that is what should be avoided with that.
Mr. Parimal Goswami reports from Bangalore, where he says that doctors do not have an issue with using mefenamic acid, but some members of the lay public are afraid. Now, how do we handle this, Parimal? First of all, they are afraid. So, the first thing is to acknowledge. I understand that you are afraid or you are anxious. I also appreciate. So, first you acknowledge, then you appreciate. I appreciate that you are worried about your health. And believe me, the fact that you are worried about your health, this is the biggest thing that you can do for better health. So, thank you for being worried. Now we know that you will move towards better health. A person who is not worried about his or her own health, how can you cure him? How can you help? So, first you acknowledge, then you appreciate. And then the third thing is to address. So, we address it by saying that mefenamic acid has been with us for 60 years. How many drugs do we have? We can't, Dr. Ketan and I, we struggle to count even five drugs like that. It is used in pediatrics. So, if it is safe for our children, why is it not safe for us? It is used in pregnancy also. You should not use in the last 2 or 3 months of pregnancy, but in the middle part of pregnancy, it's very safe to use. You can use it in women for pain related to periods, that is dysmenorrhea. So, when we can use it in children, in women of reproductive age, in pregnant women in the middle part of pregnancy, why should we worry about it? So, don't worry. So, you increase the confidence level. You should also give a backup. So first we acknowledged and appreciated, then we gave the entire context, and then you say that is you use it if your doctor has prescribed it. If there is any side effect, maybe pain abdomen, maybe reduced micturition, any skin rash, go back to your doctor. So there is always something that can be done. So thanks, Parimal, for raising this, and thanks to Team Bangalore for taking the lead in this. Dr. Ketan, your comments on Team Bangalore's question.
Yeah, no, I appreciate, and I really liked it the way you answered the various A's approach using that. So, in corollary to that, I would like to add something. So, whenever we are talking about a molecule, whether to use, not to use, or anything, so it will depend on three E's. First E would be evidence based. So, what is the evidence? Is there any evidence of using it, not using it? Second would be endorsement. Is it been endorsed by this society, that society, this organization, institutes? So after evidence, endorsement, and third would be experience. So there we would say yes. What is our we have been using now? You and me have been using it almost same number of years. I'm putting both at the same now. Though the hair wise, let us not compete. So, but with that we would put it same. So evidence, endorsement, and experience. These three E's will give us an final answer. Okay, yet whether this molecule or this compound or this drug can go rightly over here or not. And that would make the thing simpler. Thank you.
Thanks. Kaushalendra Kishore has a best practice and he suggests that media should not mention brand names. That's right, Kaushalendra. Thanks. And Vinod Manchanda ji also points out that when you put these alerts in social media, because that is text that someone is reading, that person who is reading does not know the context. There's a lot of difference between textual reading and contextual reading. So the general public gets confused and becomes afraid. So these drug safety alerts should be limited to professional streams of dissemination. We'd like to thank everyone who has logged in. And actually, Dr. Ketan, there are so many thank yous now coming your way. I think Mrs. Mehta would get upset if she got to know how many people have sent bouquets.
Here again, I would like to tell, as we have always that you have a fight with your spouse. Sometime, definitely, maybe somebody will have once a day, somebody will have once a week, somebody once a year. So I'm sure you come across, and I'm sure everyone, those who are logged in, also come across. But does that mean having one fight or having a one bad experience, you are going to leave that? Never. So same thing about a lovely, beautiful molecule. So if even if somebody has come across one in lakhs, does it mean that that molecule is bad and you are going to leave that? Not possible. And that is what exactly over here is. Thank you.
Mr. Parag Sharma and Mr. Parimal Goswami have important points to make. Parag says that on social media, anybody can go and talk about anything, but you should find somebody who is experienced. Like Dr. Ketan said, evidence, endorsement, or experience and eminence. So when you listen to someone, see that person's credentials. Parimal has a different take on this, and he says the same thing in a different way. He says that patients should listen to the expert. There is a quiz question. I just love asking quiz questions, though it's past 8 p.m. The quiz question is, what does this English word mean? Ultra crepidarian. Ultra, ULTRA, crepi, CREPI, darian, DARIAN. Ultra crepidarian. What does this mean? And what's the story of the shoemaker and the painter? So, ultra crepidarian, the shoemaker, and the painter. What story is this? We'll wait for answers to this. And in the meanwhile, we asked Dr. Ketan the last question for today's KKM Talks. This question comes from Dhananjay Shire. Sir, what message, take home message would you have for us? Us means number one, doctors, number two, patients, the general public, number three, the drug authorities. What can we do to navigate drug safety alerts and to make sure that unnecessary panic is not created?
Right. So again, a very important question, and I think let us learn out of whatever has happened out of mefenamic acid. The first is the drug safety alert is just to make everyone aware that so and so things can happen. It is just to create awareness, does not imply one that the drug has been banned, two that if you have heard of this side effect, you cannot take it. The third is that each and every medication, especially if it has come under the drug safety alert, should be taken as per the doctor's prescription. So we would discourage OTC, what we call over the counter prescription. So I'm sure you will get tempted. I mean, those who have taken this mefenamic acid for the results in fever would have taken wonderful results. But that doesn't mean that after 6 months, if you have a fever again, go across the counter and buy it, because that fever could be of different etiology and where this drug should not be used. So please take it under medical supervision, take it for the duration for which it has been prescribed, and do not repeat the same thing if you have the same symptoms at a later on. So that is where you will avoid misuse of the drug, and that applies for the, I'm sure the practitioners should make their patients aware about the misnomers pertinent to the molecule if they have got at all. And I would request even the authorities from the Ministry of Health and Family Welfare that they should make it and clear it out that though the prevalence is 1 in 10 lakhs or 1 in 1 lakh, so that because if that number doesn't come up, there is a different meaning of the side effect happening in 1 in 10 versus 1 in 10 lakhs. So that would be one thing which would be there at three different levels. Thank you.
Thank you so much, sir. And we get answers from Panchanan Rutre and Jitendra Tiwari ji, who say that ultra crepidarian means someone who doesn't know a subject but doesn't hesitate in giving advice. Now it's a democracy, it's a democratic world. We cannot stop people from going on social media and saying whatever they wish to. But who feeds the social media? It is people who click, who like messages. It is people who forward messages on WhatsApp. And that is us. It is we, the people, who do that. So this story actually comes from ancient Greece. An ancient Greek painter, his name was Apelles, he had drawn a painting, and in the painting there was a shoe, and there was a foot, and there was a shoe. So a cobbler was passing by, and a cobbler said, "You know, painter sir, what you have done, the shoe, the foot doesn't look all that good." So the painter said, "Thank you," and the painter corrected the foot. The cobbler was an expert in foot anatomy. Then the cobbler began to give other advice. This is how you should paint, this is how you should contrast, this is how you should make the face, the torso. And then the what the painter was said was, shoemaker, just thumb jao, just stay there, stick to whatever your field of expertise is. That is what we should say to people on Facebook, on YouTube, and on WhatsApp. So I think we should take the onus of this, of what we call quinary prevention. That means preventing spread of misinformation. Do not spread misinformation yourself. Do not like, do not visit a particular site which is run by someone who is not an expert on whatever he or she is speaking about. And then these will die a natural death. It is we who fuel the misinformation epidemic. So lots of thanks coming your way, like we said, and a special thanks from Dr. Siddharth Dangar from Mathura. He looks up to you. You are well known as in the entire country as someone with those three E's: someone who is evidence based, someone who is eminent, full of eminence, and someone who is experienced. And along with that, now I don't know the word that begins with the letter E, but someone who is very humble and humane, someone who is very happy. So that makes three H's for us. So I managed English.
Okay.
H is for Haryana also, which is my state. तो सब लोगों को बोल रहा हूँ जो हमारे पंजाबी टाइगर हरियाणवी लायंस हैं हिंदी में हमारा ठीक ठीक सा है because even Hindi, you know, Dr. Ketan, we don't speak the way our colleagues from UP and MP speak. So they laugh at our Hindi vocabulary as well. Uh, and we have Mr. Sharma from Lucknow. He is a faculty in nursing in SGPGI Lucknow, one of India's most prestigious medical colleges. And he thanks you for having shared so much information. This is something that is important for all physicians and nurses as well. So we've had a great discussion. It's been 70 minutes now. And we'll ask one last quiz question, but we won't wait for the answer. The question is, Neeraj Chopra ne jab bhala fenka tha, when Neeraj Chopra threw the javelin, how many meters did he throw it when he won the Olympic gold medal? अगर हम ऐसे ही साथ लिखते रहे गप्पे मारते रहे, if we gossip a little bit more, we'll beat Neeraj Chopra's world record. And we do want the record to be broken, but we want it to be broken by Neeraj Chopra himself 2 years
Yes.
from now. With this, sir, I'd like to thank you very much. Thanks for coming on KK Med Talks. Our topic for today was drug safety alerts. Thank you coming here from Nepal as well, from Kathmandu, from Rimal Yadav. And he says that whatever you taught us is relevant not only for India, but relevant for the entire South Asian continent. Thanks, Rimal, for pointing this out. So I'll take my words back and repeat them. Dr. Ketan is someone who is evidence-based, eminent, and experienced, and known not only in India but across the country, across South Asia as well. We have Faraz with us backstage. Faraz,
I,
while
I,
we thank
I,
Dr.
I would just add, Sanjay, you have been a fabulous host, and I feel honored at the KK Met Talks. I am also KK and being a part in the KK Met Talks over there. So thank you so
And
much. You have been a lovely host. Thank you.
thank you. M is for Meta and M is for Met Talks as well. So it's perfect. So this is designed for you. So we should have you
Oh,
more frequently.
I am honored. Yeah, thank you
We
so
have
much.
Faraz with us backstage. Faraz, could we please show certificate of appreciation for Dr. K.K. Mehta? Thank you. And Faraz lives in
Thank you.
Kolkata. He was the first person to answer the question that we asked initially, if you remember, Newton Ek Din Seb Girega. The movie name is Newton. The actor is Ayushman Khurrana. So Faraz, your opinion on today's KK Med Talks, what is it that you learned today? Now Faraz is a
Hello,
shy
sir,
boy,
and
but here
thank
he
you.
is.
Yeah, thank you so much, sir, for giving me again opportunity to share my experience for today's topic. As we know that understanding drug safety alert is a very important and crucial topic for our public also. As we know that drugs is a something when it is work, it is also helpful, but if it is taken in the wrong way, it is harmful also. But understanding it in a correct way is very beneficial to all the public. I hope that through this platform each one is educated, and our educated population will be very helpful to all the generation, all the family, all the relatives, sir. That's it.
Thank you, Faraz, and
Thank
thank
you.
you, Dr. Ketan, for spreading knowledge, information, wisdom, for helping us become healthier as well as happier. So, with this, I'd like to thank you once again, sir. Thank you, and Jai Hind.
Bye bye. Thank you. Bye.